Is epicanthoplasty necessary for an Asian blepharoplasty? I'm simply looking to enhance, not change, my eyes. When I went in to consult, the doctor recommended that I also get an epicanthoplasty. I got the impression that without epicanthoplasty, my Asian blepharoplasty would not come out optimal. Is this true in my case? My sisters told me without it, I'll have Down syndrome eyes. I really do not want to get the epicanthoplasty, but I'm worried I cannot have one without the other. I want to avoid the epi at all costs, as the scarring and end result is so unnatural to me.
Thank you for your question. You've submitted some photos, and with those photos you've submitted a very good, well-written question about the possible necessity of epicanthoplasty and whether or not it's really necessary for you to have a good result from Asian eyelid surgery. Well, especially from the question, the way you wrote it, you are clearly very concerned about the scars from an epicanthoplasty. And this comes down essentially to your aesthetic and what is important to you. In Asian eyelid surgery, you're going to find some variability in the doctors who you meet and their particular style as to what is optimal Asian eyelid surgery. And there are a good number of colleagues who really believe strongly in epicanthoplasty, and that's fine. From my perspective, and when I meet with patients, I always say to them that it's a well-established understanding that 50% of people of Asian descent will have a crease and 50% will not. So what we try to do, at least from my perspective, is if nature created a crease for you, how would it look? And that's kind of how I do my surgery. So what we do is I literally take a Q-tip and I just kind of roll the skin in, and I kind of see where your physical skin would actually allow and give us permission to create a crease. And generally, if for someone with a strong epicanthal fold, the crease kind of flows into it, and someone with a more subtle epicanthal fold, it just goes parallel or it tapers in much more softly. But epicanthoplasty essentially means to change the whole dynamic so that the crease goes in further and more of the inner corner of your eye is seen. So the way I see it, if nature were to create a natural double fold for you, you wouldn't have gotten an epicanthoplasty, or there wouldn't have been a difference in the epicanthus and that area where it is basically the inner corner of the eye. So with that being said, I generally don't do epicanthoplasties. I feel like if this is kind of what looks most natural, and I do share with you concerns about scarring. We use a lot of advanced technology. I've been a practicing cosmetic oculofacial plastic surgeon for over 20 years. My surgical technique and the ability to do the work is there, but predicting people's healing sometimes can be a challenge. And when we're dealing with the epicanthal area, you're dealing with the transition where the skin is thicker, and there are risks for more obvious scars and the appearance of something showing that you had surgery. So the goal from my perspective, staying in line with the idea of natural, is you should never look like you had surgery. So it should look like you were born with the crease, and that's my aesthetic. It doesn't mean it's better than anyone else's, but this is where I and my patients kind of meet to be able to have good results and happy patients. So with that being said, I would answer yes, it's possible not to do the epicanthoplasty, and as long as you understand what the anticipated outcome will be, and you know that before going in to your surgery, then you should be pretty pleased with the results as long as it's consistent with what you want to see as an outcome. So I suggest you meet with additional doctors and get some more opinions about how to do this without doing the epicanthoplasty. Look at what you will look like. take pictures and see what the crease would look like in the anticipated case scenario. It's a good predictor. It's pretty close to where we ultimately have everything settle once everything heals. And if that being said, I think you should then move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.